What causes heart murmurs in cats? Have you ever wondered what those unusual sounds during your cat's heartbeat mean? A heart murmur in cats is an abnormal sound that occurs due to turbulent blood flow within the heart or the large vessels leaving the heart. This turbulence creates a noise that a veterinarian can detect using a stethoscope during a routine checkup. There are several reasons why a cat might have a heart murmur, and they can be grouped into three main categories: congenital causes, acquired causes, and extracardiac or systemic causes. Congenital causes refer to heart defects that are present at birth. Some common defects include ventricular septal defects and atrial septal defects, which involve abnormalities in the walls or valves of the heart. These defects can lead to unusual blood flow patterns, resulting in murmurs. Interestingly, small ventricular septal defects may produce loud murmurs but often do not cause significant health issues. However, larger defects can have more serious implications. Acquired causes develop later in life. The most common acquired heart disease in cats is hypertrophic cardiomyopathy. This condition causes the heart muscle to thicken abnormally, affecting blood flow and leading to murmurs. Other acquired causes include chronic valve diseases, such as aortic or mitral insufficiency, although these are less common in cats. Extracardiac or systemic causes involve conditions outside the heart that affect blood flow or heart function. For example, anemia, which is a low red blood cell count, can reduce blood viscosity and create turbulent flow. Hyperthyroidism, where excessive thyroid hormone increases heart rate, can also lead to hypertrophic cardiomyopathy and murmurs. High blood pressure can cause changes in the heart that lead to murmurs as well. In young kittens, heavy infestations of parasites like intestinal worms, fleas, or ticks can lead to anemia or low protein levels, contributing to murmurs. During a routine veterinary checkup, heart murmurs are typically detected by listening to the cat's heart with a stethoscope. Not all murmurs indicate serious health issues. Some are considered innocent and may resolve as the cat matures. However, murmurs can also signal underlying heart disease or systemic illness, so further tests like echocardiography may be necessary to determine the cause and severity. Identifying the cause of a heart murmur is essential for guiding treatment and monitoring. For instance, if hyperthyroidism is causing the murmur, treating the thyroid condition can improve heart health. If cardiomyopathy is diagnosed, specific medications and management strategies may be required. In summary, heart murmurs in cats arise from abnormal blood flow due to congenital defects, acquired heart muscle diseases, or systemic conditions like anemia and hyperthyroidism. Regular veterinary evaluations during checkups are key to detecting murmurs early and understanding their significance for your cat's health.